I'm going to speak to you today about the research that we've been doing in partnership with the All Ireland Institute of Hospice and Palliative Care, funded by the Health Research Board. I was responsible as the primary investigator for 4 specific projects that looked at the context of palliative care and social justice. I just want to explain a little bit about why we decided to look at social justice as an issue. Internationally, palliative care has been seen as a human right. Quite recently, there's been some criticism of that, has said palliative care as a human right is a very good aspiration, but actually that's all that it is, because we're never sure who is responsible to police a human right. And sometimes human rights are levelled at the individual rather than society. And some of the really important issues that will impact on how people experience palliative care are not just related to their illness, but to things like poverty, access, housing, and power, particularly where they feel they're in a position of being vulnerable. So we wanted to look at this in the context of groups of patients who, for one reason or another, have historically found it difficult to access palliative care. Each of the 4 projects had 2 co-PIs. So the first project that we looked at was palliative care for people who had enduring mental illness. We wanted to understand why people who have mental health problems are rarely able to access palliative care. Our second project was looking at people who have learning disability. This project was linked to a much wider project called TILDA, which is a longitudinal ageing study. This second project used interviews with healthcare professionals of people who had cared for people with learning disability to try to understand the complex nature of care. The third project was looking at children with life-limiting illness. The project wanted to understand the experience of looking after a child who had a life-limiting illness, and so worked with families to try to get a better picture of that experience. Our fourth project was based in Northern Ireland. This project looked at the important issue of carers, and particularly the role of home caregivers to people who have palliative care needs. We are very aware internationally and certainly in Europe of the high number of female caregivers that are expected to provide or required to provide care for their family member within their own home. Palliative care has revisioned its focus in recent years to ensure that we include people who have both malignant and non-malignant disease. And this project focused particularly on heart failure. And the 4 projects were linked by the virtue of the fact that we were linked to the School of Social Justice in University College Dublin. Professor Lynch, the director of that study, was able to provide us with both the theory and understanding of social justice as it could be applied to palliative care. And the scholars, the PhD students and the postdoctoral scholar in Ulster, were able to avail of specific training and learning around social justice so that they would be able to apply it to the aspects of their studies that were important. And we were able to present a cohesive model which is about to be published that looks at social justice as a framework to understand palliative care better. The reason we chose to do PhDs is that one of the needs in palliative care in Ireland is that we build the capacity of the next generation of palliative care researchers to ensure that we have a new body of researchers going forward who are able to provide good academic research for the development of palliative care on the island of Ireland.